Hi everyone, this is Vivian, and not known to many, I'm actually a practicing doctor for around 10 years now. Yeah, I think 10 years now. Hindi ko na bilang, but anyway, about 10 years now, so I'm a bit old, and I also look after old people. I'm working overseas, and I'm gonna share with you some facts information regarding a vaccination. So I received Pfizer vaccine, so I'm gonna share with you about the Pfizer vaccine. First of all, ano ba yung COVID? So yung COVID, I know you are well versed about it, and you've been seeing and hearing in social media and television about the symptoms and symptoms. Just a recap, it's a respiratory illness that can affect any part of your body. So your symptoms can range into mild, into a severe type. It is spread mainly by droplets, and if you touch the surface, contaminated surface, and also airborne routes. The symptoms typically appear within 2 to 14 days, kaya may quarantine lasts for 14 days. And after you are exposed, and the symptoms range from no symptoms or fever, cough, shortness of breath, some experience sore throat, runny nose, loss of smell, and loss of taste. And the complications are quite bad in some patients, ranging from respiratory failure, heart attacks, blood clots, and other long-term complications, long-term problems. At isa na doon, ang mahal magpa-admit pag meron kang COVID-19, especially if you are admitted probably in a private institution, nakikita mo ang mahal-mahal ng mga binabayaran nila, especially if you have the complications. Akalain mo mag-i-intubate na sa ICU ka. It's so expensive, people. It's so expensive. So, ano ba yung Pfizer COVID vaccine? It is given to prevent a COVID-19 for persons ages 16 and above and older. So, ito is a messenger RNA. Ang gawa nito is to help yung immune system mo to produce a positive response. It is known to have a 95% efficacy in preventing COVID-19. So usually you have 2 doses. After you receive your first dose, so 21 days thereafter. And so that you can have the full protection of the from the virus. And yung Pfizer vaccine has been assessed to be safe for use. However, you may experience some side effects, which is similar to other vaccines, but they only last for about 1 to 3 days, and they're usually mild side effects. And so, sino ba ang pwedeng makatanggap? Who should get the vaccine? So, actually, sana dapat lahat pero dun sa recommendation is 16 years old and above or older, 16 years old and older. Tapos, if you don't have any of the conditions that I'll be mentioning. So, example, you should not get Pfizer vaccine if you're under 16 years old or pregnant, if you have history of severe allergic reaction. So, example, yung sa amin, pag meron kang history na namaga, yung dila mo, hindi ka makahinga sa allergic reaction, or severe reactions dun sa mga vaccines na re-receive mo before. So as much as possible, hindi ka bibigyan. Hindi binibigyan yung mga kasama ko. So actually they want to have a vaccine given to them, pero pagdating dun sa screener, dahil merong ganun sila, hindi ka muna. So we are waiting, hopefully they can have another type of vaccine. So kung meron kang conditions, like example, pregnant ka, planning to get pregnancy, or you're breastfeeding, medyo pinagpapawalan, immunocompromised, and if you are taking medications that can reduce your immune system, or you are actively being treated for cancer, or you are receiving stem cell transplantation or organ transplantation, hindi po kayo makakatanggap. Example, meron kang any allergies, pero yung mga allergies na pag severe naman po, pero pag mild, it's okay. So I have a allergic reaction to ciprofloxacin, merong rash sa likod nga ko na tumutubo, hindi ko nga alam yung na allergic ko pala yon, allergies pala yon. Meron akong allergies sa naproxen, meron din akong allergies sa tetanus toxoid, toxoid, tetanus toxoid. And those are mild redness and rashes. And this doesn't prevent me, prevent me from receiving a vaccine kasi yung ano lang naman nila is pag severe allergic reactions. Kung meron kang blood thinning agents, merong mga precautions eh. Kung na-infected ka na rin before, so you don't need to receive one, or naka-receive ka ng receive another COVID-19 vaccine. So, like for example, naka-receive ka ng Sinovac or naka-receive ka ng Astra, hindi ka na maka-receive ng Pfizer. Ganon. So, sa hospital na pinagagawa namin, may screener at saka meron silang protocol, malinis na protocol, maayos na protocol, sino ang dapat mag-receive. So, may mga checklist yon. Meron kang pipirmahan ng mga dokumento bago ka maka-receive ng vaccines. So, it's just a 2 pages form back-to-back which you need to complete. Okay. So, paano ba siya binibigay? It is injected into intramuscularly. So, binigyan ako sa left dahil this is, usually bigay naman nila dun sa arm na hindi mo usually ginagamit. Kasi after nga ng vaccine mo, you will experience some mild side effects, diba? Especially numbness. Okay, numbness. Ano ba yung mga ingredients ng Pfizer? Actually, marami. Merong sugar, merong asin, merong potassium. Merong, syempre, yung virus itself, yung mRNA, hindi pala virus itself, mRNA, BNT162, B2 mRNA, merong mga preservatives, hindi ko na kilala yung babasahin. Ayun, they're not important. So, anong magiging side effects? Possible side effects. And paano nyo ba mamamanage? So, the usual side effects lang naman, like pain, redness, swelling in the injection site. Some of my friends and colleagues experience fever and chills, some of them headache, muscle pain, and joint pain. So sa akin, nung pag-inject ko din sa site, after a few hours, nakafeel ako ng parang konting pain. Pero nag-take ako ng paracetamol, and which resolved within few hours. And then, I didn't experience any fever, just like my friends. They take 1 day off after they receive because yung iba is mataas yung lagnat. But it's fine. Usually, the symptoms, the side effects last for 1 to 3 days and they are just mild. So, and then, yung iba is parang pagod. Parang mabigat yung pakiramdam. So, I have some friends who are applying some ice packs while they are on duty or they're working, and because they're working, and some of them of course take a leave to rest. Okay, some experience some lymph node swelling in your neck, in your arms, but don't worry, this will go away. Okay, but if you develop allergies, sayang hindi ka na maka-receive ng second dose of the vaccine. Okay, so if for example wala dito sa mga side effects at saka yung mga minention ko, tapos parang sobra yung nagiging side effect, please see the doctor immediately or go to the nearest emergency room. Okay? So, rare lang naman yung mga severe allergic reactions. So, like for example, marami na thousands and thousands na yung binigyan dun sa Singapore. Merong mga reported cases na nag-allergy sila to vaccine, but they are well, no one died. Okay? So, signs of severe allergic reaction na kailangan mong bantayan is difficulty of breathing, swelling of your face, your throat, your lips. Some experience fast heartbeat, dizziness, weakness, or bad rash all over your body. So, and if you have experienced severe allergic reaction, meron kaming protocol na fina-follow. Pag severe allergic reaction, ano ang gagawin? What to do? What number to call? Merong merong app pwede nilang i-submit questions. Merong app na merong QR code katulad dito. Yan, QR code. Okay? Pagkatapos, so, ano ba after vaccination, what you should do? Any other advice after vaccination? So merong mga, di ba may mga sinabi akong mga as much as contraindications, pero hindi naman siya totally na hindi pwedeng mag-receive. Like for example, naka-immunosuppressant therapy ako. So, pwede ko siya talagang itigil. O, para mag-create ako ng response sa body. So, finalo ko yung sa akin. Wala pa naman kasing studies dun sa I'm receiving a parang methotrexate. It's an immunosuppressant therapy with the COVID vaccine. So, wala pa talaga siyang study. So, finalo ko yung nasa flu, at least parang 1 to 2 weeks before your vaccination, you stop your immunosuppressants, which is I did. Pero mga 3 weeks nga, alos may isang buwan ko siyang tinigil. More than 3 weeks. Okay? So, if you're on blood thinning medicines, hindi siya contraindicated. So, kung may aspirin, may clopidogrel, may rivaroxaban, ipapress lang po ng maayos yung site. At least 5 minutes. If you're breastfeeding, you may wish kung yung breastfeeding, kung hindi ka talaga magtitigil ng mag-breastfeeding, so medyo contrary. Pero, kung mag-ano ka naman, pwede mo namang bigyan siya ng other alternative feeding. So, yung suggestion is 5 to 7 days before yung vaccination mo, pwede kang pwede mong i-interrupt mo yung breastfeeding wish. Okay? And if you're planning for pregnancy, 1 month after your second dose, wait until 1 month after your second dose ka magpa-vaccine. So, use your strategy para you can have your sex, diba? But of course, use other method to for prevention, para hindi ka mabuntis. Okay? So, and then how you should report pala yung mga side effects mo. Sa amin, may sino ako na di ba, na parang QR code. So, ganun sa amin pag merong kang QR code. So, hopefully, sa Pilipinas, magkakaroon din ng mga strategic way in reporting the vaccine. Likely, you will go to the nearest health center if you have some side effects. And hopefully, i-record nila, and para yung data, makakreate tayo ng data nationwide, para malaman natin how yung mga other side effects na hindi pa nakikita dahil bago pa nga yung mga vaccines. So hopefully you have listened and completed up to the end. So thank you very much for watching. So this is all for now. This is your I'm Dr. Vivian, but I don't blog against medicine most of the time. I mean, this is my first vlog again for medicine with medical topic. Tinatry ko siyang mag-vlog before, but I'm too lazy to make some slides to show to you. So anyway, ngayon dahil wala akong ginagawa, I'm in quarantine, and I think pag nasa quarantine ka, 7 days ka na wala kang kausap, you become talkative. So I'll just use this energy to share with you guys. So thank you so much for watching, and hope you have learned a bit regarding vaccination on Pfizer. So thank you very much.